Hello and welcome to the Leaders Council podcast with me, Joshua Jackson. As regular listeners will know, this podcast is all about hearing from the people who get up each day and make this country work, supporting their staff, clients, service users to be the best that they can be. And today I'm joined by Dr. Linda Edwards, Chief Executive of Education for Health and author of the Barefoot Executive Leadership Skills for the 21st Century. Education for Health is a dynamic UK-based healthcare charity with a primary focus on supporting health improvements. And it's Linda. It's great to have you on today. It's going to be great to hear your expertise. And if you wouldn't mind just giving us a bit of background about yourself and Education for Health, that would be great.
Yes, of course. I've been at the helm at Education for Health for the last 4 years. I traditionally call myself the third matriarch. The organisation has been running for 34 years. It came from the desire of the founder, Greta Barnes, to provide high quality training for nurses in asthma. Since then, it's gone through many changes and evolved into something that is now a leading edge health charity providing education and training for all healthcare professionals in primary and secondary care. My own background is I started off as a podiatrist many moons ago, became a chief exec in 2 or 3 NHS organisations. I then decided that I wanted to explore what leadership was all about. Having been foisted into a leadership position at the tender age of 32, I felt I ought to learn from people who were wiser than myself. So I undertook a PhD in leadership and studied with cultures around the world. So I spent 13 years running my own business and travelling while I did the research for my PhD.
That's a really interesting way of going about things, and also, very, sort of humble of you as well to know that you didn't know everything at 32, and that can sometimes be the age where people do think that their world is them and they are the hero of their story, and that's very good to hear.
Yeah, and I have to say it was very enlightening because I spent time with leaders in indigenous cultures, principally to understand how they led and what leadership meant to them. And the discoveries I made were all around being authentic. And if you are authentic and you lead from the heart as well as from the head, then organizations and cultures can thrive. If we put in too much process thinking and try to enforce our own map of the world onto other people, that's when we run into problems.
That's, again, something very important that people do need to realise that cultural differences are there, and there are different ways of working and learning, especially and it seems like you've taken that journey to heart. But let's go back to sort of Education for Health for a moment, and I'm sure we'll explore your leadership ideas as we go forwards. But given the experiences and the chaos in many respects of the last sort of 18 months, how have you been sort of dealing with that as both the head of an organisation which supports nurses and people that are wanting to improve themselves for long-term care, as well as dealing with the sort of stresses of the business?
I think resilience is the one word that kind of resonates throughout the last 18 months. Resilience of ourselves as an organisation and resilience of the people that come and learn with us, the people that have been on the front line trying to manage through something that no one has ever experienced before. So for us, it was back in March 2020 when Boris Johnson made his announcement. There was a huge suck-in of air. We furloughed 70% of our staff and then said, so what on earth do we do now? I mean, can we actually make this work? And there was a very loud voice in my head saying, for heaven's sake, you may do respiratory. If a respiratory education and training charity can't survive now, who can? So we set about putting in place as many systems and processes as we could to support the people who were learning with us, because we had people on academic courses who were juggling different ways of working, being put on the front line or being put into specialisms they'd never been in before, while still trying to undertake an academic course, and then looking at what we could do to speed up the process of putting all of our education and training into a virtual environment. So no mean feat really, but I have to say we've got there, and it's no small credit to the team pulling together to enable us to do that. Talking to our learners and students now, they've been really appreciative of the support that the tutors have given them, the fact that they've been accessible when perhaps other courses had stopped. We continued and provided that one-to-one and small group support, and learned a huge amount on the way.
And it was obviously, do you think that people's education was negatively affected during this time? Do you think that people were then too busy actually having to deal with the challenges around healthcare and the stresses and the long hours that they weren't able to sort of turn to you? Or do you think that actually, going online was refreshing for people to then be able to continue their education and have something that they didn't have to think about the stresses of the day to day?
It was really mixed, because some people were extraordinarily stressed. So we had a lot of people needing to defer their courses and have extensions on their courses. But I was absolutely amazed that 600 people during the first 6 months carried on with their education. And when talking to them, many of them, as you say, found that it was quite refreshing to have a little bit of headspace outside of the juggling of busy lives on the work front and the home front, because we have to remember that children were at home and not at school. So many people were juggling home working on the front line and looking after their children. So, yeah, it was a huge juggling act for many people, but it really encouraged us to look at how we could provide education and learning at all levels in small bite-sized chunks. So enabling people to access what they needed quickly and easily when they could. So if they wanted to learn, pick up the laptop and do a small piece of e-learning at midnight, there was nothing stopping them from doing that. But where they found the energy from, I'm not quite sure.
That's the thing, isn't it? It's being able to maintain that forward progress. And you're right, people that have been working on, wards and dealing with the sort of crisis, really, that's the levels to which people have been able to rise up and continue really have been inspiring. But do you think that, will you be sort of continuing with this bite-sized element? Will you be learning the lessons from the last year where you've had to pivot and change and carrying that on? Or do you think that actually people are going to benefit from getting back more to the the traditional style of learning?
Well, it's interesting because obviously we're continually talking to our learners and asking them what they need and what they think the future looks like and how could we do things differently or better. And the consistent message is that it works really well in the virtual environment. So the education and training is not one-dimensional, it's three-dimensional. So there are opportunities to learn in small chunks. There are opportunities to meet virtually with groups of people who are on the same journey as themselves, and they've found that really invaluable. One of the biggest problems that people find if they do face-to-face education is if you're in a GP practice, for instance, releasing somebody for a day to travel to, Warwick or Newcastle to do some training takes a lot more time out of practice than enabling people to have 2 or 3 hours a week over a period of time to access live webinars or to do some e-learning is much more productive for everybody. There will be face-to-face training, I am sure, but it will be a rarity rather than the norm.
It can be something that people, when the important sections, the bits that you need to make sure get right, whereas the sort of more e-learning and the book learning can be done in that virtual environment. And you're right, it does take less time, and that's a really interesting, perspective that these things, maybe more people are going to be able to turn to you to get training and to further their education than potentially was there before. Maybe it's opened up for you.
Yeah, yes, I think we're hopeful that it has, and even very practical courses like spirometry. We've found that we've been running our interactive blended online learning model, and we have about 170, 180 people each at any given time actually studying in that way with us. And spirometry is something that, people have always seen as a very practical, hands-on and training program.
And looking obviously at the sort of pressures on the NHS, pressures on GPs at the moment, the backlog, the time, do you think there is going to be a knock-on effect of people that are going to be able to, continue to train, or do you think that, there always needs to be time to train, that will actually then have sort of beneficial elements?
Well, I mean, the fundamental line and why people need training in clinical skills is safety. Safety for their patients and the constant evolution of development in long-term conditions or any treatment, to be honest. So it's really important that people need to refresh and keep up to date with their skills. There was an interesting article today in the Health Services Journal from one of the directors of Health Education England saying that training and education needs to be a priority for medical staff and all clinicians to ensure that their practices are safe.
That's something that people are going to have to take note of, isn't it? The safety element there, and that's something that when people are talking about people on the front line suffering burnouts, that there's not enough sort of cover, the holidays haven't been there over this time, and then you're still having to learn new things and to refresh. Safety is going to be paramount, and hopefully that you're going to be there to support in these sort of agile ways that you've adapted to and come up with. Is there anything that you are going to be doing that's new or fresh, or something that you actually think you can pivot into looking ahead, or is it going to be just the sort of same as you have been?
We don't stand still. That's for sure. Yep. And we're constantly evolving and looking at what we can do to support people and to make it easy and fun, so that people have a bit of light time when they're doing their learning rather than it being terribly serious. So it's how we give people the knowledge and know how to conduct their day-to-day practice, but to give people tips and hints and different spins on things, so that it doesn't become so much of a drain on their mental emotional resources, because it is mentally and physically exhausting seeing people day in, day out with multiple conditions. One of our big learnings, I think, in all of this is a year ago now, we created a COVID resource centre, an online resource centre that people can buy at a very nominal subscription for 6 months or a year. There are weekly updates on that, so any new piece of guidance that comes out, any new developments and research, we've got podcasts, we've got webinars, we run live sessions on specific topics that are hot topics, so that people can access either the live session or go back and listen to the recording afterwards. That has proved to be really valuable. So we're doing a similar subscription program for diabetes and other long-term conditions. We're also looking at how we can provide new skills in small ways for people, so that they can get a taste of something and decide whether they need or want to explore it in more detail. So lots and lots of things are happening at the moment. The big one for us, the most exciting one, is we've just been accredited to provide a level 4, which is a higher education certificate course that we've developed over the last 6 months to enable healthcare assistants and healthcare support workers to put their toe on the academic ladder without being overwhelmed by launching into being a nursing assistant in the full program that goes with that. So it's a stepping stone to build confidence and competence to enable people to develop a career who may not have otherwise considered it.
That's really interesting. Always looks very sort of positive then, going forwards. Bringing new people in, helping them as much as you possibly can, and still maintaining that sort of level of update and as you say, safety with the training. But things aren't always positive. And do you think that there were any sort of mistakes that you made over the course of this time period, or do you think there's anything that you sort of think you should have done differently?
Well, we always learn, don't we? And for me, a mistake is a learning opportunity. So we have blundered on occasions in the last 18 months trying to ensure that we could provide high quality services at a time when it was really difficult to do so. So having sufficient resource allocated to support people has been one of our biggest learnings, because the level of support that people needed, we underestimated. I'm not sure anybody could have estimated it accurately, to be fair to ourselves, but we did underestimate that. So those first 6 months were really difficult. We've reached out to more people. We've done quite a lot of work with the pharmacy profession. But I think some of the things that we've learned are about not running too fast. Because we've had a good idea. We've wanted to get it in place for people who are on the wards and working in practices. But the thing that we learned was we needed to take that little bit of extra time to make sure that it was totally polished, so that people who were stressed were able to easily access what they needed, rather than find that a system didn't quite work properly. So it's about taking a breath and stopping and ensuring that what we're doing is the best that we think we can do at that point in time, and we've put everything into it.
And that's all anybody can ask, isn't it? That you are learning the lessons and you are doing as much as you possibly can to help and reflect. But one of the major talking points over this time is that people underestimated a lot of the stresses and the chaos, and obviously the support that would be needed, both within organisations, within your local communities, but also from governments. And do you think there was enough that was done, especially considering it's your industry of healthcare, to support people, to make sure that there was the aid there, to make sure that there was enough, to be able to keep people going each day?
I think, whatever anyone's political views are, nobody'd ever come across this experience before, and everybody was finding their way. And I think, a bit of compassion from all of us as we were working our way through would have been more helpful. I think, when you face something that's unknown and that's so massive, I don't think anybody thought at the beginning that it would run for so long, or that so many people would unfortunately lose their lives. So we were just all finding our way. And yes, we can look back and say the furlough scheme was very helpful and we were very grateful for that. But actually, if we were to do all this again, we would understand that you need more resource rather than less resource in an organisation like ours to enable us to provide the support that we would have liked. But that's hindsight, and we can always learn from that, can't we?
Absolutely. You can't. No one's going to be looking back at this and think that everything was perfect, as we can see from the initial report this week, and the public inquiry that's going to be going on next year is, no doubt going to be quite damaging. But a lot was done during the initial stages, and a lot has continued to be done, and that's something that the government does have to sort of hold its head up high and say, well, we may have made mistakes, but we wouldn't be here without that. And you're right. Even on an individual level, we all need to do that as well. But one thing that we always like to talk about on this show is obviously personal leadership, personal style, how you've sort of learned, changed yourself throughout this period. It isn't just the organisation that's there, it's the sort of leaders that are going to be around as well. And do you think that, your leadership style has had to adapt throughout this period, or, do you think that you had the skills there already?
Bit of both, I think, because none of us have ever experienced anything like this, but it's that resilience. It's coming back to the fact of, do we throw the towel in, or do we actually say, come on, let's see what we can do? And I have to say that the team at Education for Health were fantastic. We had 11 people working for 9 months, and everybody pulled together to do what they could do. We all took salary cuts to enable us to continue to function without any income coming in. So that was a real test of the tenacity and the resilience of all of us in the organisation to say, right, so what is it we need to do? And we had to learn to do things that we would never have ever dreamed of doing. Some very basic skills, some very basic tasks, but by all pulling together and nobody saying, I can't do that, we were able to get through. And I think I'm hopeful that obviously my leadership style had an influence and an impact on that, but I think most of it was everybody just pulling together.
Well, that's again really nice to hear. Some people have had to turn to other managing directors or chief executives to be able to speak freely and to have a sort of shoulder to not to cry on, but to lean on many times. People that understand the stresses that running a business and trying to protect people's jobs when making hard decisions has had to come through. But the fact that you've had your team already there that have all stood up and been that support network, that's incredibly positive and really says something about the ethos that was within the organization already, your leadership style, your leadership capabilities to be able to have that already and sort of moving forward. So I offer my congratulations, very well done on you and the team being able to sort of weather that. But obviously one of the areas that you were going to be looking to be doing was to be running sort of leadership masterclasses as well at Education for Health. Has that been able to come into effect? Have you started that process, and how's that sort of looking forwards?
We've it went on hold for a short period, but the first program will start in January, and the central tenet of it is going to be about resilience, because I think those of us that have come through all of this recognise that resilience is the most powerful thing, and to help people to develop their own type of resilience, because we all do it differently, we all process differently, we all have different triggers. So it's about how to turn what we have inside of us into a form of resilience that supports us rather than drains us.
And if people particularly wanted to jump onto those sort of courses, how do they get involved in that? Is that something that you're just offering to current learners, or is that something that anybody can jump into?
No, it will be open to everybody. We're launching our Learning Academy, which is our non-academic academy for anyone to come along and join us. We're launching that in November. Part of that process will be a seminar with myself and another person who's experienced in leadership, to give people a taste of what the masterclasses might be like. They're entitled to Finding the Leader Within, and it's all about helping people to look at themselves and find their own strengths and develop and grow those.
Sounds really quite interesting, and it'd be great to have you on again in the future when you can talk about the changes that you've implemented and the sort of learning outcomes there. It's always great when business coaches and leadership coaches come together and share ideas and inspire, really, especially for new leaders coming through or people that just need a bit of confidence. So that'd be really interesting to hear about as we go forwards. But again, looking to the future, how do you think that everything's going to be going over the next sort of 12 months? Do you think we're going to be back to normal? Do you think that there's going to be more pressure put on? Do you think that actually this level of resilience is going to start to crumble as people have been worked very hard, and that people need a break that they potentially aren't getting?
Yeah, people are definitely exhausted, and it is going to take time for that to turn around. The normal will be a different normal from the normal we experienced before. I mean, we can see it, can't we, in the way that general practices, for instance, are offering their services, a lot more telephone consultations, people only going into the practice when they actually need something physically. And I think that's the way of the world. I think it's particularly challenging for older people because they don't understand why things can't go back to normal, but actually productivity will increase and already is increasing by people having more flexible ways of accessing healthcare. And, the trouble is that 6.1 million people now have cardiovascular disease, and we reckon there's about 120,000 people with undiagnosed type 2 diabetes having come through the pandemic, and a similar number around heart failure and other cardiovascular diseases. It's a huge mountain, and the work and carrying on the way we were, delivering services all face to face. Everybody always wanted to see the GP. All of that is changing now, so that the right people can see and triage people with long-term conditions, help them to manage their condition more effectively, and also do more prevention work. Because the prevalence of both cardiovascular disease and diabetes have shot up because of the way people have been living in the last 18 months.
And this might be a little bit controversial. It always is when we're talking about healthcare. But do you see that there's going to be an avenue for sort of private organisations to be coming in and fulfilling some of that gap, fulfilling some of the initial consultation period, and then taking a little bit of burden off the NHS? Or do you think that actually things should be sticking with the GP system as it is now, with the the special, then having referrals to specialists, and just trying to sort of muddle through?
I think for me, it will be the mixed model would work. There are people who, if you pulled your knee out, they go to their GP, but actually if they went to the chiropractor, it would be fixed really quickly and easily. So there's something about how we can support people about understanding their own body and where to go for the right kind of help, because that would unclog the system somewhat. I mean, I am astounded. I don't know why I continue to be astounded about how little people understand about their own bodies and where the various organs are and what does what.
Yeah.
And so there's probably a bit of a plea in here for schools to educate people a bit more about their own physiology. Because if people understood what was going on in their body a little bit more, they may be able to take more control and not be rushing to the health service every time some small incident happens that they could manage themselves or manage differently.
That's an interesting one. Again, going back to the education side of things, it is about making sure that people do understand a little bit more about the healthy choices that they can make, and understanding a little bit more about their own bodies. And you're right, maybe that does start young, but maybe that's something you can look into in the future, supporting more secondary primary schools with resources and things like that. And it could be an interesting new chapter. But again, just sort of looking for at education for health and going forward, is there anything that you're going to be doing other than just sort of the masterclass series and the leadership style? But is there anything going to be fundamentally changing, or new projects that are coming up?
We will be building on hopefully the successful launch of our level 4 program, because that means we can then offer them higher education certificate right through to postgraduate education, combining that with small bite-sized bits of, what are the new things that are coming out around diabetes? What are the new things around supporting people with mental health? What can we do to help people work more effectively in multidisciplinary teams? There are lots of small things that we can do right the way through to, as I say, the full master's program in long-term conditions. So looking at all of that and cutting that in different ways, making it more accessible, I think is going to be quite a fun journey for us to go on. Because there's no point in going out and reinventing things when we've got lots of things that work really well. It's how we deliver them in a way that's accessible to the people that need them, and not always informal education.
That's a good point as well. It looks like there's an awful lot that's coming up. There's going to be a lot of sort of spinning plates in the air for you as you navigate these challenging times, but also try and improve as well. So I very much look forward to having you back on the show in a few months, sort of Q2 of next year, to see what the changes have been and how people have responded to them. And actually, when we can potentially look back on this COVID period and think, what the worst is really behind us. And, now is the time for new ideas and a fresh start.
Excellent. It's been a pleasure.
Brilliant. Linda, thank you ever so much. And thank you to everyone that's been listening in. Goodbye.
Bye-bye.
That was Dr. Linda Edwards, CEO of Education for Health. A really interesting conversation looking at some of the challenges that are faced by people continuing to have education within healthcare, and some of the solutions that can be done moving forwards. Thank you all ever so much for listening in today, and I will be back with you next week.